Hi, I'm Peggy Bell, and I'm here with Carla Ryder. And our session that we're going to share with you today is Enable Others to Act, Sharing Your Story. The objectives for this presentation will include review the purpose of telling your story, which is dissemination, describe the components of an abstract, and draft an abstract based on your individual project. The purpose of this session is to help you with enabling others to act by sharing your story. And it's really important that you do share your story because that's how the knowledge gets out to other nurses and advances the profession. And that's really key in improving the health outcomes of the people we serve. So something to think about is if you're concerned about, well, how important will my story be? Just remember that at the biennial convention, there will be thousands of nurses there, and they will have the opportunity to come through in a poster session and look at the poster with you and interact with you. So you will have one-on-one opportunities to share your stories with others. The sharing of your story really goes beyond just that one-on-one connection. It's really considered dissemination to the broader body of nursing. And the actual definition of dissemination is that you're airing, you're telling the story with public exposure, and you're spreading that information. So you're opening up the subject to widespread discussion and debate so that others can also view your work and think about how it could apply in their own practice or in their own clinical situation. There are three methods of dissemination with posters, presentations, and publications. We're only asking you to do a poster for this particular academy, but when you leave the academy, you'll still have the opportunity to work with others to turn that into a presentation or even a publication, depending on what you decide in the future. I'm now going to talk to you about starting with the abstract because that's the foundation of telling your story. It's where you're giving a brief overview, a real summary of what you're going to tell other people. And you can see on the slide that there are some bullet points of steps to take in putting together an abstract. You're also going to be getting a handout from Sigma with guidelines for putting together your abstract and exactly how many words they want in the abstract. So just know that in the summary of your abstract, you're going to be limited to 25 to 50 words. And then in the text of the rest of the story, you will have at least 300 to 1,500 words. Now, some of those numbers sound very small and some of those sound very large, but it means that you've got to be really clear about what it is you want to say in your story and the amount of time that you have to tell it and in the space in your submission online that you have to say it. So these steps that are given here, it's called MRAD, Introduction, Methods, Results, Discussion, Conclusions. Those are the very same steps that Sigma is going to ask you to speak to. So just briefly, if we look at the introduction, you're giving a little background as to why your study is important and the purpose of why you're doing the study. And then in the methods sections, you're going to talk about the project activities that you've engaged in and also the evaluation methods that you use so you could tell that you really made a difference at the end of your project. And then you're going to share your results and talk about what you got from your evaluation methods. And then lastly, you're going to discuss and provide a conclusion so that other people who are listening to you will know what the implications for research and practice are for their own practice. In the introduction to your abstract, you really need to make the case for why it was important for you to do the project in the first place, and why it's important to the site where you're working. So you provided some background information, and some of you may have done this in your application when you talked about the project that you wanted to complete while you were in the academy. So you may have prevalence of the issue that you have across the nation or in your region, and you'll want to share that because it's important to know why it was important to you to do this. and what the cost might be that you have addressed. And costs may not be direct costs that you started a clinic, but the clinic itself may have offset costs to other places. For example, some of you are doing something for depression. And if you started a clinic for depression, perhaps you have offset costs to the emergency room. So you've saved the institution some money. You've also talked about the needs of the population that you have and also the importance to the profession. So the purpose can actually be obtained by looking at your elevator speech that you started in workshop 1, how you can concisely say that, because the purpose of your study, remembering your overview, can only have 25 to 50 words. So it's very important that you get everything in about the purpose of why you did it, what you did, and what you found in just a few words. The methods section will be brief in your abstract, but will be a fuller explanation in your poster. And during the methods section, this is where you're going to speak to who, what, when, where. Who's your target population? What did you plan to do? What did you do to this? Where did this occur and where's the project now? You may be 50% through, you may be 100% through. You want to share that with your population because that could explain your numbers, especially if they're low. You want to create the context for people who are viewing your poster to understand what's going on with it and how they might see that in their own situation. In the method section, it was important to talk about the who. So the sample is the who. How many people were involved and how many people were touched by the project? Did you use patients or did you use nurses? And then describe everyone who's involved, noting their characteristics of age if it's important, gender, years of schooling if that's important for nurses, years of practice for nurses, and then race and ethnicity of your population. It's also important to talk a bit about attrition, particularly if you have a large number, but yet you lost 25 to 30% of them, or any percentage that's significant, because you want the people who are looking at your poster to understand what happened to them instead of noting on your table that there's a discrepancy. Continuing with methods, we want to talk more about the other processes that we mentioned before, the when and the where. So the setting is important to talk about because if it's an acute care setting versus primary care, that can make a difference for people who want to replicate your study. How long it took you to do this, and basically you're pretty confined to the time period you had for the academy, and the design of your project. And if you're not clear on this, please talk to your faculty member or mentor, because maybe you did a pre-test, post-test. They can help you put the phrase in that really reflects the method that you used. And the human subjects approval, especially if you were able to get IRB approval from your facility or if it was expedited review. And then really talk about the change or the intervention that happened. And if there are some steps that are still left to complete, maybe you almost got them through, but some data is still pending. And then provide the information chronologically from the time that you started the project until now, so that they don't get lost in some of the changing of the order that you're telling them, because then they're going to be reading top to bottom on your poster. And so that information needs to flow well in that column. The methods also speak to how you're going to measure the change or the success that you have. So just a reminder to look back at your logic model. And in terms of how did you measure it, you may also need to look back at your change toolkit, because you want to talk about the process measures or the outcome measures that you use along the way. So you can really talk about the success that you had with your project and the difference that you made. Describing your measurement and titling it will be very important to people who want to replicate your study. So make sure that you put the title of the scale that you used and the type of the scale that it is. A Likert scale is not necessarily applicable to maybe a toddler, but other things would be. So talk about the variability of the responses that you had and how you get a total score that adds up and what the score range actually means. Sometimes a 10 means very good, sometimes a 0 means very good. And then mention the validity and reliability of the measurement that you use because you want other people to feel comfortable using that as well. Reporting your statistical analysis is important to show how, or actually demonstrate how effective your project was in changing what you wanted to change. So naturally, you want to work with your team to talk about what's the appropriate descriptive statistics to use or statistical package to use in order to look at that. And once you get your findings, you'll want to put them into perspective with what you actually were trying to do with the project so that you can analyze the change that occurred. Did you find in the beginning of the study that you had high rates of depression or low rates of bonding, but then at the end of the study you had high rates of bonding that led to low rates of depression? So make sure that you are able to work with maybe a statistician or your faculty or mentor so that you can get the best prediction that you can out of your statistical package. The results of your project will be what you're going to be most happy about because that's going to give you a sense of success. You may have planned for a lot of things, but this is really describe what really happened. What were you really able to count or measure? So what were the descriptive statistics for the baseline data? And comparing that to later data will help you show the impact. What were the descriptive statistics for the outcome variable? And what change actually occurred? This slide will help you think about your results in terms of your organization and other people who are affected by your project. Because even though you may have done a project that was just in your unit, you probably had an impact on the organization overall. It could be with cost savings, it could be with employee patient satisfaction, it could be with quality safety improvements. So you want to make sure you look into that because you may actually be able to get some really good data on that. And you want to report your beneficiaries, the people who benefited from the project that you conducted. Remember that Sigma is collecting this data for Johnson & Johnson, so it's important to talk about the community, the patients, the providers, everyone who was benefited by your project. And don't forget to complete that sheet so we'll have that specific data. And if you haven't been doing that already, I would encourage you to go ahead and do that now so that you're not late turning that information in. The results of your study will be what you're most proud of, so make sure that you put that in a pictorial way that people who look at it can see the effect that you've had. So only use numbers. Don't do discussion here. Don't draw conclusions. Don't explain, don't rationalize, don't talk about how they're different from findings in other studies. Just use those tables, graphs, histograms, pie charts, whatever you have, so people can clearly see the numbers that are involved and the numbers that did well with your study. So save all the rest of that for the discussion section. In the discussion section, it's where you really get to talk about what you expected to find and what was unexpected that you found, whether it's your sample, your setting, your processes, or your measures. And then discuss if these findings were similar or different than findings that other people found in their studies. And then discuss what worked well and what did not work well. You may find that the patients were so excited about being in your project that they talked it up to the other nurses, and that made them more engaged with your project. So everyone benefited from doing the project. As with all studies, you're going to want to report your limitations. So usually that has to do with sample size. Just when you want to measure something with depressed women, there are no depressed women. So was your sample size adequate for the statistical method that you were using? Was there an aspect of the intervention that was setting or culturally bound? If you're doing a study with Haitian women because you have a high concentration of them, that might not be something that's accessible for other people across the country. And that would be a limitation for them in doing your study. The previous slides have been talking to you about how to put together your abstract, but this slide reminds you that you're also going to be sharing your leadership journey as part of telling your story. And most of this information will be presented in your poster. But even so, you need to be preparing yourself for how you'll put that on the poster. So we're going to be giving you an assignment for workshop 2, and that is going to be to think about and reflect on your leadership journey up to this point, so you'll be able to relate that to your poster presentation. So ask yourself these questions in the meantime. Did you meet your leadership goals? And how have you grown or changed? And how would you describe your journey related to the KP model? We'll be talking to you about these at Workshop 2 and helping you put those into a better format. And so your assignment for preparing for Workshop 2 is to bring a first draft of your abstract and reflect on the 3 questions that we just reviewed. And I like this quote here: the first draft is just you telling yourself the story. And I think the beauty of going through the Academy is that you'll be able to tell your story to thousands. And that will be exciting for you and for the Academy. So we look forward to seeing you at Workshop 2.